Member of Calgary-Midnapore.
Well, thank you very much, Madam Speaker. I'm always happy to be in the House and to speak on behalf of my constituents, being a very proud member of Parliament from Alberta, born and raised in my riding. So always very happy to be here representing the people of Calgary-Midnapore. But it certainly has been a very difficult 15 months. That goes without saying. That's the reason that we are here this evening. The pain that I have seen around me has just been absolutely extraordinary as I've watched businesses, families, and individuals attempt to cope with the realities of the pandemic and what this has meant for everybody and the sacrifices everyone made, certainly across Canada, but also within Alberta. I mean, businesses shut their doors, some after many years. It's incredibly regretful. That's the reason I decided to put forth the Calgary-Midnapore Economic Recovery Board in an effort to try and come up with solutions as a community. I've seen parents struggle with children being out of school as a result of the necessity to make changes to our educational system. Of course, this is happening again. Tomorrow will be my son's last day in school until after the long weekend. And today, when I was at the car dealership picking up my car for servicing, I overheard a set of parents talking about how they just don't know they're going to deal with it this time. And of course, the terrible toll that mental health problems have taken on Canadians and certainly Albertans as well during this time. And I'm very happy that as part of our plan to secure the future, our leader has chosen to make mental health one of the key pieces of the platform. But I'm sure, Madam Speaker, like many other Canadians, like many other Albertans, the question that rests in my mind is, how did we get to this place? Because that's what this debate is really about, Madam Speaker. How did we get to this place? Well, Madam Speaker, I think back to January, February 2020 when we were in the House. We still had, of course, many new members finding their feet, but nonetheless, a strong team that tried to call attention to this government to take stronger action. I recall the member from Edmonton Riverbend screaming at the top of his lungs in an effort to get the Minister of Health to take action regarding our borders. Of course, we all know about the terrible judgment of the Prime Minister to send the extensive amount of personal protective equipment overseas to China, only to leave healthcare workers without it, those on the front lines defenseless weeks later, not even months later, but again, a very bad start to this situation. And of course, our call for the government to use the tools that were available, but which they refused to use. Our team across the board, including our current Shadow Minister for Health, the member from Calgary Nose Hill, has been relentless in our asking of using for the tools which are available, specifically therapeutics and rapid tests. But again, this fell upon the deaf ears of the government. So again, I ask, how did we get to this place? Madam Speaker, as Shadow Minister for Transport, I can certainly tell you that the industry did everything that they possibly could in an effort to maintain operations, to resume and maintain normalcy for Canadians to continue about their lives and their business, because certainly we have all been away from our family members and our loved ones for so long and have not had the opportunities to go and visit places and see people. And it was the industry actually that led the way in terms of rapid testing. We had, of course, the project at YVR set up by WestJet, an Albertan company that has suffered terribly as a result of this mismanagement of the pandemic by the federal government. We had the McMaster project, which led to incredible data finds, which could have been used in a constructive manner going forward, but it was not. And most importantly, and what I'm most proud of, was the YYC pilot project, which was set up here with much success and which would have allowed for a shorter quarantine time across the nation. But instead, we saw the government ignore the investments of industry, of those individuals who put themselves forward, be part of the data collection. And instead, we ended up with a terrible knee-jerk reaction from the government several times over, where both Canadians and industry had to respond. First, with the 72-hour PCR test, brought in at the worst time possible for travelers over the holidays, leaving industry without any time to respond at all. And I must take a moment and compliment what good corporate players and societal players the airline sector has been over and over. First, repatriating Canadians, and I've done a lot of that in my time as a consular officer previously for the Government of Canada, bringing in personal protective equipment and really bringing in precious cargo. So really doing their part. But again, their requests, the work that they put in, were ignored by this government, leading to the 72-hour PCR test. And like anything, Madam Speaker, when you don't take action earlier on, the problem compounds. It just creates to a larger and larger problem. This happens with anything in life. Certainly, we've even seen within this government with debt, for example. But the next step in that, Madam Speaker, regarding the transport file was the resulting hotel quarantine. Again, this was something very severe and draconian that could have been avoided had the government taken the proper steps earlier on in the pandemic, but they did not. And so again, I, like so many other Canadians, find myself asking, how did we get to this place? And then finally, Madam Speaker, the point that has been brought up by my colleagues previously, and which I will mention again, is that of vaccines. Everyone has always said that this is the ticket out of this pandemic, is the vaccines. But this government absolutely failed at their procurement strategy from day one. And the result is that we have been left months behind other nations, and we see that they are beginning to live life again and beginning to return to normal, not only within the travel sector, but in life as we used to know it. There have been numerous delays as a result of this government's terrible execution of procurement, overpaying for vaccines, us ending up last in line. They have not been transparent in regards to the schedules of these vaccines, leaving Canadians to wonder, as most recent as this week, if they will get when they will get a second dose. So not knowing when life will resume again as normal, and really just no plan at all forward, no light at the end of the tunnel. So again, Madam Speaker, I ask myself, how did we get to this place? Canadians are asking, how did we get to this place? The reason we are having this debate here tonight regarding Alberta is, how did we get to this place? And Madam Speaker, the answer is obvious. It is the Prime Minister that brought us to this place. It is the Prime Minister and his incompetent cabinet and government that brought us to this place. And Madam Speaker, I will finish with the member from Edmonton Strathcona who proposed the debate this evening. She has been complicit in holding them in this place. Thank you very much, Madam Speaker.
Questions and comments? The Honourable Member for South Okanagan, West Kootenay.
Well, thank you, Madam Speaker. And, you know, the member repeated time and time again, how did we get to this place? Well, we're here tonight because we're speaking about the tragic situation in Alberta, the very painful place that Alberta is in. And, you know, I live in British Columbia, and we have the same access to vaccines that Alberta has. We have the same situation about borders and airlines coming in. The difference, the one difference, is the haphazard management of the Kenney government in opening and closing businesses, and the health orders have been entirely inadequate. And will she only admit that is the difference? That is how we got to this place.
The Honourable Member for Calgary-Midnapore.
Thank you very much, Madam Speaker, and thank you very much to my colleague from the province next door for the question. I find the question just so very disappointing because I think in posing the very question itself, it is not recognizing the origin of the problem, which is the federal government. And secondly, Madam Speaker, frankly, I find the spirit of his question to be very disappointing. This is not a time for comparison, who's doing better, who's doing worse. This is a time for us to come together as Canadians. And that's what this discussion should be about tonight. Not who's doing better, who did worse. This is a time where we should be coming together as Canadians for solutions. And that question did not indicate that. Thank you.
Questions and comments? The Honourable Parliamentary Secretary to the Deputy Prime Minister and the Minister of Finance.
Thank you, Madam Speaker, and I thank my colleague for her remarks. For reasons others have articulated this evening previously, I vehemently disagree with the member on the success of Canada's vaccine procurement. However, if I accept her position that the federal government's procurement strategy has been insufficient, I cannot find a charitable interpretation of her argument that would suggest that public health measures today in Alberta would not be required to stem the spread of COVID-19. I'd ask the honourable member, what public health measures does she think should be implemented in order to protect the public's health until sufficient vaccines are present to inoculate the population?
The honourable member for Calgary-Midnapore.
Thank you very much, Madam Speaker, and thank you to the Parliamentary Secretary, who I know had a brief residence in Alberta and with whom I had the pleasure of sitting on the status of women. You know, the way out of this is the vaccine. It's just, it couldn't be more crystal clear than that. So the focus should be on receiving the vaccines, distributing the vaccines, and getting them in the arms of Canadians. Everything that is going on now, this week, all of the sacrifices that Albertans have been making and will continue to make, and even more severely in the coming 3 weeks, are frankly just, it's the residue of this government's inaction.
We have time for a brief question. The honourable member for Saanich Gulf Islands.
Thank you, Madam Speaker. I'll try to be very brief. To my honourable friend from Calgary-Midnapore, my concern is that we need everything brought to bear on this problem, in this threat to our society and the whole planet. We need to keep people locked down. We need, because the variants may even be able to outrace the vaccinations. And this just, I want to put to the honourable member from the Center for Disease Control in the United States, the Director Rochelle Walensky said, even with the vaccinations in the U.S., she said, I have a recurring fear of impending doom. Those are her words, because she's worried that with the vaccinations, the U.S. public will have a false sense of security and ignore the health warnings, ignore the need to continue to be very, very careful. And I'm afraid the Conservatives may lead people to think, once you get vaccinated, you're safe.
The honourable member for Calgary-Midnapore, a brief answer, please.
The real fear for Canadians is that we will never get out of this. And it's because they hear the words and the attitudes of members such as the Honourable Member for Saanich Gulf Islands. Thank you.